It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is cataracts, and with me is Dr. Carrie Palmer, a Corneal Specialist with the Eye Institute. Welcome, Dr. Palmer.
Thank you. Thank you for having me.
I'm glad to have you here on the show. We found out before we talked about the show, we're actually neighbors. We didn't know that. We live right around the corner from each other.
Small world.
Yeah, well, this is something, Dr. Palmer, that I have found in doing television and radio work, writing for the newspaper, and with my post-Navy career, that we have so much in common with people, we simply don't know it. And it's often through an unexpected contact that we meet people. And generally speaking, those contacts enable us to help other people. And yeah. So our show is really about senior care, what people can do to help seniors, but cataracts become extremely important to seniors. And I think my first question is, I had something I hear that said, what is the requirement for being an eye specialist or a cataract specialist, but you're a corneal expert? But cataracts are also your forte, right?
Yes, for sure. I would say cataract surgery is typically the bread and butter of ophthalmology. Most general ophthalmologists perform cataract surgery along with a specialist of the front part of the eye, like a corneal specialist such as myself.
But in addressing the subject of cataracts and seniors, what are some of the most prominent problems that, as a doctor and an eye specialist, do you encounter in working with seniors and cataract removal?
Well, cataracts are extremely common. Basically, everyone gets a cataract, and we base the decision on whether or not to remove the cataract based on how it's affecting their daily life activities. So cataracts cause a general fogginess of vision, sometimes trouble with glare or light sensitivity, trouble reading the fine print despite wearing glasses. And definitely with seniors too, if they have difficulty getting around and the cataracts are disrupting the vision, it may be a very good idea to have the cataracts removed just to help with their daily life activities. So
when you have a condition and you have cataracts, and I know I have cataracts, so reading the newsprint, when it becomes more difficult, and when I try to read my books, if I can't get a large print book, I sort of have to move my eyes around to find a spot where I can see the print. Is that the cataract causing that fogginess or that impairment in my vision?
Most likely, that's probably the cataract causing the fogginess. Sometimes trying to bring the book into lighter conditions. It's really the low light conditions where it gets real tricky to read. Using magnifiers or increasing the size, like you said, of the font can help too. But most likely that probably is the cataracts causing problems.
I find that if I go outside and have the direct sunlight, I can see a lot better. Mm-hmm. Or if I have a brighter bulb in the lamp by my chair, I can see better.
Correct.
But with these new light bulbs it's going to make it more difficult for people to see. Have you ever thought about that, the intensity of light with the new light bulbs?
It can go both ways. You need brighter light in order to see if you have a cataract, but cataracts can cause glare issues too with bright light. So it makes it kind of a catch-21.
Let's say if a person does have a cataract, though, do you recommend removal of the cataracts as soon as possible, or are there conditions that you would recommend expediency and whether or not you would remove a cataract?
Nowadays, we are removing cataracts at an earlier stage in their development due to the advanced technology, since the actual procedure is pretty quick. So I usually base my decision whether or not to remove a cataract on how it's affecting the patient's daily life activities. We may remove a cataract earlier than another patient if, say, the patient is driving a lot at nighttime and is having problems driving due to the career or the jobs or whatever it is. But and then we have other patients who really their cataracts may be larger, but they don't feel like it's quite affecting their daily life activities. So I really based it on an individual basis whether or not to remove the cataract.
How do you take a cataract off? What do you do when you take a cataract off?
The only way to remove a cataract is to do a procedure where we have to go into the eye to actually remove the cataract. So I actually have a model here.
I want to see what you're going to do. I want to watch this too.
Okay. Cataract is actually inside the eye. So it's the cloudiness of the natural lens inside the eye. So I can take this out for you. This is actually a clear lens, but as the cataract matures, it ages, it forms an opacity, a cloudiness, and that's why it affects our vision. So during the procedure, we make a small, less than 3 millimeter incision in the cornea, and we use a special ultrasound machine, a probe, to go in. The pupil's dilated. We go in and remove the cataract with an ultrasound probe, so it kind of breaks it up and sucks it out. And then we actually put a lens implant in its place, and we do different measurements before the surgery to determine what power of lens implant to place in the eye to help the patient focus. If no lens implant is placed, the eye really wouldn't be able to focus on things. So that's why we always place a lens implant after removing the cataract.
But when you actually are washing the cataract off of the inside of the eye?
Pretty much. The ultrasound machine breaks it up, so we're actually able to aspirate it out of the eye with the ultrasound machine. Okay.
In my case, I have a condition, I can't remember what it's called, but I'm sure you do. They're concerned if they do what you just described, it'll take my lens or my cornea off. What condition is that called?
I believe you have a condition called Fuchs dystrophy of the cornea, which the cornea is actually the surface of the eye here, where the inner portion of your cornea has fewer cells than the average cornea. And whenever you do surgery, you lose some of those cells. Those cells don't regenerate. The function of those cells is to pull fluid out of the cornea to keep it nice and thin, keep it from swelling. So when you have advanced Fuchs dystrophy, you're at risk for swelling of the cornea, which also will cause fogginess of vision. So it may require an additional corneal surgery after cataract surgery if you have swelling in the cornea.
Okay, let's say if a person has a cataract, and in my case, the worst happens. Let's say you're going to take my cataracts off. You go in and you do this procedure, and you find that too much of the inside of my eye is washed off. That's the best way I can say it. Then what do? Put a new cornea or a new lens in?
Yep, I will still place the intraocular lens like originally planned. Typically, I would let the eye heal. there are certain drops we can use to try to bring that swelling of the cornea down. But if the cornea remains swollen, then I would go ahead and do a separate procedure, which would be basically a partial corneal transplant.
How dangerous, first of all, let's talk about the cataract. How dangerous is the removal of a cataract with present day techniques and saying everything goes right? Is it dangerous?
If everything goes right, I would say it would not be dangerous. No.
What could make it dangerous?
There are certain risks to performing any procedure.
Okay.
The risks involved with cataract surgery are very minimal. I'd say it has above a 95% success rate. Risks involved, we do go into the eye, so there's a risk of infection, which we prevent with antibiotic drops we have the patient use after the surgery. There's a risk of swelling, such as we said of the cornea, or swelling in the back part of the eye. Typically, the drops we use after the surgery will help bring down any swelling there. There's a risk of increased eye pressure after the procedure, and we have drops we use to help bring the pressure down. A risk of bleeding these days is extremely minimal with the way we do the surgery. And there's always a risk of needing additional surgery for one reason or another, say if there's a hole or a tear in the retina, which can lead to retinal detachment. All these risks are extremely low, but of course they exist because it is a procedure.
You know, when you go in, I've been operated, I have all kinds of operations performed on my body. But I cringe at the thought of somebody going into my eye. It's kind of like being the dentist. I think the dentists are the greatest inflictors of pain that the world has ever known.
Agreed.
Do you agree?
Yes.
You do? Okay, good.
Not eye surgery.
I'm only joking. But when you think about the eye, it's such a delicate thing. And you're talking about making a cut in the eye, going inside the eye, and taking that cataract off. If you do that, can you tell when you see the ease or the degree of difficulty in removing the cataract, can you tell whether that person's going to need a corneal or a lens implant?
The lens implant, which we place after cataract is removed, we place that in all patients. A corneal issue, typically during the surgery, you won't be able to tell until you see them post-operatively and see how the cornea is healing. Certain things can happen during the surgery, but extremely rare. But there are different procedures we could do. Say if there's a tear in the back part of the capsule where the fluid in the back part of the eye comes forward, we do what's called a vitrectomy during the surgery. So there are different complications that can occur. It's very rare, but the surgeons are always prepared to handle those if something
have there been any studies that have been done that would sort of show the success rate in cataract removal? Is there a...
The studies show there's typically, all studies are different, but typically over 95% success rate. So it's a very successful type of surgery. It's one of the most common surgeries done in America since everyone gets cataracts.
So whether or not a person develops cataracts is not dependent on age or any other medical factor, or is it?
It can be. Cataracts typically are caused, most of the time are caused just by the natural aging of the lens inside the eye. They form usually slowly around our 40s or so is when we start seeing a minor cataracts, and once they grow, they usually slowly progress as the lens ages, and once they grow to affect the patient's vision and their daily life activities, that's when we consider removing them. And there are certain medical conditions that cause the cataract to grow at a faster rate. Most commonly, diabetes, increased blood sugar can cause the cataract to grow faster than typically it would just due to aging. There are certain medications, especially steroid eye drops or oral steroids, that can cause a cataract to grow at a faster rate than expected. And other medical conditions, trauma. There are congenital cataracts. Some infants are born with cataracts. So there are different reasons, but by far the most common cause of cataract is just the natural aging of the lens in the eye.
Okay. Has there been any kind of a study done at, or have you, in your practice, seen any correlation between heart disease and eye disease? I'm thinking it's not so much a factor now, but it used to be that if you're going to have dental work done and you were a heart patient, that they gave you an antibiotic before they did the dental procedure. Mm-hmm. And making that type of a connection, is there anything other like it would happen with the body, with the heart or the mouth, that would relate to the eye?
For eye procedures, if there's a heart condition, we do not have to treat with oral antibiotics due to really where we're operating. There's really no blood vessels in that area. So really the procedure we do in the eye the inflammation stays within the eye. There's no risk of having any heart conditions from the surgery.
So you generally would not worry about any other disease implication or anything affecting what you would do with the eye then?
Not too much. The only thing with diabetes, when the blood sugar is under control, that would raise your chance of infection with any type of surgery. So we usually try to have the patient's blood sugar come under control before the surgery.
How about if a person was on blood thinners? Would they have to be off of blood thinners to have eye surgery?
These days, with the way we do the surgery, we actually no longer need to stop the blood thinners.
Is that again?
With the way we do the surgery these days, we no longer need to stop blood thinners. They can continue the blood thinner.
You don't have to stop it?
Nope.
How long does it take? It's from the time you lay a person on that. Oh, okay, let's just talk about it. You're going to operate on me, and you're going to take my cataracts off. What do I do? Do I sit in a chair or do I lay down?
During the procedure, when I'm performing the procedure, you'll be lying flat.
Okay.
And I do use the microscope because it's very, very small type of area to operate in. But the actual procedure usually takes about 10 minutes or so.
10 minutes?
Pretty quick.
Do you sedate a person?
You do receive IV sedation during the surgery. You're not entirely asleep. You don't have general anesthesia, but you are sedated, and we can titrate the amount of sedation according to how much anxiety the patient is feeling.
So you're talking about the nervous Norvis type?
Yes.
If I was laying in and I saw you approach me with a couple of scalpels in your hand, would you worry about whether I was going to jump or move? How do you ensure that a person, is their head in a device, or is it just lay there?
Typically, you just lay there. We put a sterile drape over the face, so everything's sterile. And we tell the patient, if you feel like you have to move, if you have to cough or anything, just let me know so I can take the instruments out of the eye. But since it's just a fairly quick procedure, patients do real well. And with the IV sedation, they tend to be nice and relaxed, and it actually runs quite smoothly.
And you generally do one eye at a time?
We always do one eye at a time, just due to the certain risks, like infection, which I've never personally seen an infection from the surgery, but just to be on the safe side. You mentioned infections. Is it an uncommon thing to develop an eye infection as a result of a cataract surgery? It's extremely uncommon to develop an eye infection. It's been documented, but it is uncommon. We actually do have the patient start antibiotic drops the day before the surgery to help prevent that. The day of surgery, the eye's prepped with typically betadine, unless the patient is allergic to betadine. All the bacteria is sterilized before the procedure.
I'm sitting here talking to you about eye surgery, and I'm thinking about the time that I was executive officer on a submarine tender, and we had a medical department on that submarine tender, and one of my doctors was a dentist, was one of the foremost facial reconstruction surgeons in the United States at the time, Dr. Jim Fairstad. But my senior dentist, Dr. Holcomb, decided one day he was going to fill a front tooth. The closer he got the shot of Novocaine, he was looking in the mirror, trying to give himself a Novocaine shot so that he could fill his own tooth. The long and short was he never got the shot into his gum where he could fill his own tooth. So, but we laughed about that for a long time. But almost for every serious medical procedure that you can talk about, there's another aspect of it that is a lighter side, that if you approach these things the right way, you lessen your fear and you create a greater opportunity for success. What have you, as a doctor, an eye doctor, been able to establish any kind of a correlation between the success rate of your patients and the way they approach eye surgery? Is that a fair question?
Yeah, so I guess that the patients who, the patients who can really figure out how their vision is affecting their daily life activities. If patients come in thinking, they'll go back with high expectations. So they'll go back to their 20s when they're able to see distance and close, no problem. The higher expectation type patients are a little more tricky afterwards. They may be not quite as happy, but the patients who have a sense, well, this is going to help clear up the vision. They still may need reading glasses, which is real common. But basically just have remove some of the general fogginess of vision. Those patients tend to be real happy.
I think that another question I had was discussing the importance of cataract treatment and surgery in a case of seniors. Is there any kind of treatment short of removal for cataracts?
Well, really the only way to get rid of cataracts is to remove them, but definitely we can do an examination, see if glasses may help. Glasses sometimes can help. As cataracts grow, your prescription of glasses will change, so that's the first thing we check. Outside, we always recommend sunglasses, as the bright light can affect the cataracts, and actually our UV light can cause cataracts to grow potentially. As we said earlier, just increasing the font size and when they're reading and things like that can help. But
you reach a point where you can only increase the magnification on the glasses so much, and I'm at that point where they can't increase the magnification anymore. So the only way that I could probably see better would be to have the cataracts removed.
It comes to a point where, yes, the change in the glasses just won't help any longer. And the next decision would be whether or not to go ahead and remove the cataract, especially if it's affecting your lifestyle and you're just not getting around as you used to be able to. And since it is technology-wise, it's so advanced and it is a fairly quick procedure, quick recovery time. I would say once it's affecting your lifestyle, I would say go ahead and remove it. They don't go away; they only slowly get bigger, and they'll slowly cause worsening of vision.
Yeah, that's a good point you bring up. The cataracts increase in size if you don't remove them.
Mm-hmm. Yes.
I never thought about that.
Yes, and the larger they get, the more energy it can potentially take to remove the cataract, the more possible inflammation afterwards. So that's why I recommend nowadays, if they're starting to really bother your vision, I would say just go ahead and have it removed.
Yep. And compared to my 16 or I think it was 14 or 16 hours to repair my aorta when it's split wide open, 10 minutes is much quicker.
I would say so.
Cataract surgery for those 65 and over, that's covered under Medicare, correct?
Yes. Cataract surgery is covered by Medicare if we prove it is affecting the vision or causing some glare issues. There are newer, we call them premium lenses on the market now that are not covered by insurance.
Okay, let's talk about that for a minute. That's because I think we haven't got much time left. But there's a real danger that after cataract surgery, you'd have to have a lens replacement, right?
After cataract surgery, well, at the same time we remove the cataract, we place the lens in the eye. So that's all done under one.
Oh, you do that as
procedure.
normal things. Mm-hmm. Okay, so there's a difference in the type of lenses you can put in.
Yes. There are newer premium lenses out. There's lenses called multifocal lenses, which have multiple rings within it, and the goal is to help correct for distance and for reading. So the traditional lens covered by insurance, we basically correct both eyes for distance. Patient still needs to wear reading glasses. With the newer multifocal lenses, these help both with the distance and the reading, decreasing your dependency on glasses. We can never guarantee you'll be glasses free, but those are the best lenses out now to help be less dependent on your glasses.
Just as a matter of interest, I'm not going to nail you down to a price, but about what would it cost to have a premium lens put in? About?
A premium multifocal lens usually runs around $2,500.
About $2,500?
Per lens.
Per lens?
Mm-hmm.
When you think about it, that's not bad. No. I think what it costs for my dental implants is certainly less than my dental implants.
There you go. It's a good way to look at it.
We're almost out of time. Any final advice for people on cataracts?
My final advice would be if you are experiencing decrease in vision of any type, I would recommend seeing an eye doctor, being an optometrist or an ophthalmologist, just to get your vision checked. And we can check, see if it's the cataracts causing the decreased vision, or there could be other things also. So really it requires a full dilated exam to figure out what's going on and what the reason is for the decreased vision.
If they wanted to see Dr. Carrie Palmer, all they'd have to do is call the Eye Institute, and your main office is over on NASA Boulevard?
Yes.
And that's where your office is, right?
Correct, yep.
Okay. Thank you, Dr. Palmer. And I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, you can call us at 321-473-770. For more information on senior care and resources, visit our website at helpingseniorsofbrevard.com. And be sure to listen to Focus on Seniors on radio station 1300 AM WMEL every Thursday morning at 9 a.m. And look for us in your Florida Today Health section every Thursday for our Focus on Seniors column. I'm Joe Steckler, and thank you for joining us today for Focus on Seniors. And thank you, Dr. Palmer.
Thank you very much.